Hello, my name is Erin Stolz. I am a Master in Public Health candidate at CUNY Graduate School of Public Health with a focus in environmental and occupational health science. Today, I will be discussing the topic addressing demographic disparities in global COVID-19 policies and corresponding health outcomes. Thank you. COVID-19 emerged in December 2019 and has since been declared a pandemic that has infected over 66 million people in 191 countries and has resulted in over 1.5 million deaths, although figures are assumed to be much greater. The objective of this study was to assess the mortality of COVID-19 in the European Union, Switzerland, and the United Kingdom during the presumptive phase of exponential increase of cases, which was from January 22nd to May 31st, 2020. Sociodemographic variables were evaluated and effectiveness of state-mandated social distancing policies were reviewed. Data totaling COVID-19 deaths were obtained and reviewed every 3 days during the phase of exponential increase. Crude rates per 100,000 and cases per million were calculated for COVID-19 deaths. Sociodemographic variables were obtained from the World Bank, and these became the independent variables evaluated in a multivariate regression analysis for deaths per 100,000, as well as totals of the days of continued increase of new cases within the studied region. The Boltzmann sigmoidal function was used to delineate cumulative counts of COVID-19 deaths for each country as a function of time. This curve describes the trend of mortality over time. Utilizing a non-linear model was useful because the output, COVID-19 deaths, is not a constant, but rather a variable that changes during the exponential phase. By May 31st, there were approximately 1.5 million infections and 170,000 deaths as a result of COVID-19 within the studied region. Sociodemographic variables assessed in this study include the percent of the sampled population from urban regions, those over the age of 65, percent male, GDP per capita, and the average death rate. Countries within the least death per 100,000 group were Slovakia, Latvia, Cyprus, and Greece. Countries with the most deaths per 100,000 include Belgium, the United Kingdom, and Spain. Boltzmann fitting modeled positively with Lithuania, Latvia, and Portugal, and negatively with Bulgaria, Romania, and Spain. There is a strong positive correlation between deaths per 100,000 and those over the age of 65. And the greatest mean contribution for deaths per 100,000 was for the percent of the population from urban regions. When evaluating the regression for the days of increase, which calculated the days of continued new cases, the greatest mean contribution was for the male population, which also demonstrated a moderate positive correlation in the regression analysis. As of March 15th, COVID-19 had spread to all countries within the studied region. There was a short window of opportunity for countries affected to implement policy-based non-pharmaceutical interventions and control measures to slow the spread, such as stay-at-home orders and state-mandated social distancing. When this window was missed, healthcare systems became overwhelmed and conditions worsened. Italy was the first country to impose these restrictions, however, did so after widespread community transmission had already begun. Austria and Germany also imposed restrictions early on, and although Germany is the most populous nation in this study, it experienced fairly low deaths per 100,000 when compared to Belgium, the UK, Spain, the Netherlands, and France. Overall, the complexity and scale of the COVID-19 pandemic brought to light inadequate planning and preparedness throughout the entirety of the studied region. COVID-19 spread rapidly throughout the studied region during the phase of exponential increase. It devastated livelihoods, overwhelmed healthcare systems, and led to a massive economic downturn. In the absence of an effective vaccine or pharmaceutical treatments, interventions such as state-mandated social distancing measures proved to be largely effective in curbing the spread of community transmission and thus reducing mortality. Thank you all for your time and for your attention. If there are any questions, I will take them now. Thank you.